what are you guys noticing and thinking about, whether it's about some of your own reactions to things or people you've worked with or clients you've worked with in the past? What thoughts and questions are you guys having at this point? We can go ahead and put that in the comments section. I think that might be the easiest. Or, you know what, actually, I think that'll take too long for folks to write out. So go ahead and unmute yourself. I think that might be quicker. What thoughts or questions or observations do you guys have as we've gone through some of this?
The biggest thing I've learned so far is how a diagnosis is a snapshot in time. Mm-hmm. And I wonder, well, I know that leads to great racial disparities, especially when people are being diagnosed. I just think of kind of the stereotypical, oh, well, you have a bad attitude or you're being oppositional. Yes. And how those labels are very quick to be placed, especially upon Black women. Yes. And so, like, I kind of already kind of knew that, but like you really put it into focus. That happens because, you know, the diagnosis is only a snapshot in time, and it's almost very discouraging because, I mean, you would think we're getting better at racial dynamics in our healthcare system, but it doesn't sound like we are. So
yeah. And that's such an important conversation, Tamika. I'm sorry, I think I stepped on you there a little bit. I will say a couple of things about that. Number one, you know, it's sort of glass half empty, glass half full, right? There's so much more we have to do. I've been in this field long enough to say that I think things have improved a lot, if only, and again, this is not nearly enough, but the fact that we have a body of research now that we didn't have 10 or 20 or 30 years ago that say, you know, these are real. This you can find over and over and over again. And I do think it's a conversation that more mental health people are having. So I think what I would say to your comments is that, you know, some diagnoses are great. In my book, I talk about the fact that a diagnosis is a story. And some stories are easy to tell, and some stories are really complicated. And some stories turn out to be pretty reliable, and some don't. So the point isn't, of course, that every diagnosis is wrong, but I think it's really important for you guys in your roles, sometimes as advocates for your clients, that not every diagnosis is right either, or, you know, what looked like it fit here doesn't fit anymore. And trauma is notorious for being misdiagnosed as other things. Where I think this intersects for your clients, especially for women of color, is we know also that Black girls are sexualized much younger, that I think that translates into being, for me, it kind of goes back to that. Is this a reaction or is it behavior? Is this a thoughtful choice, or was this a survival reaction? So I think when you put all of those things together, there's so much more blame and so much more, you're doing this on purpose. It's, you know, I was an hourly worker. I know what that feels like when someone's having a hard day. And I think you are deliberately making my job hard today. Or you are deliberately, I love this when people go sabotaging yourself. And I'm like, kinda. But I think mostly people are in brain states that are meant for survival. They're not meant for day-to-day life. So I think that we can put all of those lenses together and see how vulnerable some of the women and young women, older women, children that you guys are going to be interacting with, who really need people who can look through all of those lenses, can see those vulnerabilities, and at times advocate for that. And again, I'm not totally sure exactly where you guys are going to be going in your roles, but I end up talking with lots of groups of people about, if you feel like they don't have the support they need from the medical system or the mental health system, you may be the person who says, I need you to take another look. Or I don't think the person who did this was culturally competent, or I don't think trauma was fully examined in this context, or whatever. Yeah, it's still a huge problem. But I'm very hopeful because of people like you guys, actually. So thank you for that, Tamika. Any other thoughts or comments? Bridget mentioned the stigma that goes with that. Yes, absolutely. please continue to put any thoughts or observations in the chat section. I'm going to jump back into the presentation, but we will leave time at the end for more of this discussion. And I love especially hearing either your experiences or your professional insight, or how you're thinking that some of this might be applied as you guys move forward in putting your program together. So, okay, here we go, guys. One last time, I'm going to try to share my screen. We'll see if this works. Okay, so we're going to now move into this slide I don't have time for today, but this might be something further on when we talk about what it's like for the helpers and how we deal with some of these stresses. So Tamika, some of the stuff you talked about those feelings of discouragement, this maybe is a conversation for another day. But that's really important to me as well, because we have to take good care of ourselves. Okay. So for the rest of my time with you, we're really going to be focusing on this, that if we want someone else to feel safe, connected, and in control, we have to have some amount of that for ourselves as well. It doesn't mean that you have to be perfectly serene, but we have to find ways to ground ourselves in the present and to be regulated in our brains and bodies in order to help someone else start to regulate. A lot of what passes between two people is not necessarily verbal. People read our body language, they read our faces. People who've been traumatized by other people are often like human lie detectors. They can sense the smallest shift in our voices, in our face, whatever. Like I said, sometimes I think it's even pheromones. Like human beings can be very tuned in to the emotions of another person. Now, this doesn't mean that you're not allowed to have emotions. It just means that if you are, first of all, aware of what's going on inside of you, and that's why I've been hitting this so hard with you guys. What are your sensations? What are your feelings? What are your thoughts? Then you can start to regulate them and get yourself into a grounded, present state. And that is when you're able to figure out what to do with this person in front of you. I know that sometimes when I do trauma trainings, people think, oh, cool, you're going to give me the magic spell that I can use, the magic words to get this person who's being a pain in the butt to stop being a pain in the butt. And believe me, if I had that magic spell, I would charge you guys like $1 million. I would be so rich, right? Because everybody would pay. I do not, but that's okay because I don't need it. I don't know the women that are in your program, but you will. You will get to know them. And especially putting on this set of glasses in terms of understanding vulnerability and understanding the impact of traumatic stress and understanding the survival protocols that people may go into. You will, over time, and sometimes it takes a lot of time and patience, but you will start to learn what is it that helps Susie feel safe, connected, and in control. And that may be different than what Sierra needs to feel safe, connected, and in control. And that's different than what little baby Dakota needs, blah, blah, blah. I think I'm naming truck models. I'm not sure. Anyway, the point is you will learn your people. You will know what works for them and what doesn't work for someone else. And again, the way that we can open ourselves to that compassionate awareness, the way that we can open ourselves to be curious and willing to try different things is if we feel safe, connected, and in control. If we are freaking out or shut down, we can't do that. Not only can we not help that other person feel that way, but we can't figure out what it is that works for them because we're in survival mode ourselves, right? So here's what we are going to do. We are going to spend some time with the calmer skills. And I'm going to start you guys with an exercise that I taught my staff when I was a supervisor and that I like to do with audiences. So this is completely voluntary. If you want to participate in it, you can. And if you don't, it's just going to take a few minutes and you're welcome to not. Okay. So here's what I'm going to ask you guys to do. Do one last little check-in, thinking about the times that you have felt stressed or that you have felt anxious. Some of you are already reflecting on what that feels like in your body, what your emotions are, what your thoughts are, etc. And once you've connected to that a little bit, now we're going to do a breathing exercise. So this is very simple, and it really just has two parts. All I'm going to ask you to do is breathe. Pretty easy. And when you breathe out, you are going to say a phrase to yourself in your head. Okay, you're not going to say it out loud. And this phrase needs to be two things. It needs to be something that is personally meaningful to you. So something that you find inspiring or calming or reassuring. A lot of times people will pick something from like their favorite prayer or poem or song lyric or something like that. And all you're going to do is on your out breath, you're going to say that phrase to yourself. Now, that also means that it needs to be short enough that if you were going to say it out loud, you could say it on one out breath. So, for example, if your favorite prayer is the Lord's Prayer, I don't know, maybe Bridget can do this with all of her diving skills, but you probably can't say that whole prayer without passing out. You can't say it in one breath, but you might be able to say, Our Father who art in heaven, or Shema Yisrael, or Allah Akbar, or Let It Be, or whatever it is, doesn't matter. Now, because I know that I have a lot of high achieving people in the audience, I expect that some of you are currently experiencing what I like to call phrase anxiety. And that means that you're saying to yourself, okay, well, I've thought of something, but what if that's not the most inspiring quote? Do I know a more inspiring one? Is that really my favorite song? I don't know. So calm down. Just pick something for right now. If you like this practice and you decide to incorporate it, as part of your daily self-care, whatever, you're allowed to change your phrase later. But for right now, just pick something. And what I'm going to have you do is go ahead and kind of remove distractions from your environment. If you're comfortable closing your eyes, you can do that. Some people are not comfortable, and that's fine. You can just rest your gaze on your tabletop or wherever you are. Just make sure your phone is put away and you're not looking at notes or anything, and you don't have anything to kind of pull your attention. I think this is nice to do, trying to get kind of planted in your body. So if you can rest your feet flat on the floor, you might want to do that. Don't do anything that causes any kind of discomfort or pain or anything like that. I am a petite American, so my feet don't touch the floor, so you might need a block under your feet, or sit in whatever way is comfortable. It's kind of nice if you're sitting up straight, right? So that the breath can travel in and out of your body. And if we're hunched over, it's harder for it to do that. So you don't have to strain. I don't want you to be feeling any kind of strain or stress in your core, but it's nice if your core is kind of awake. And if you need maybe support behind your back so that you can sit up without straining, go ahead and do that. Just do whatever so that you feel planted in your seat and your feet are planted on the floor. And when I tell you to begin, we're just going to do this for a minute or two. So again, you're welcome to close your eyes if you want, but you're just going to breathe normally and say your phrase to yourself on your out breath. And begin. When you get distracted by a sensation or a feeling or a thought, just notice that without judgment and come back to your breath and your phrase. Go ahead and release that. If you've closed your eyes, go ahead and open your eyes. And one last time, just go ahead and do a little check-in, maybe starting from your feet, going all the way up to your head. What are you aware of in your body? What feelings or thoughts are you noticing? And especially notice any change. There may not have been any change at all, or you may have noticed a subtle change or a more dramatic one. But notice what feels different in your body and in your brain after doing that. And go ahead, if a few of you are willing to put that in the chat section, you can just give me a couple words while I talk about the exercise we just did. Excuse me 1 second. So what we just did is called the relaxation response. And if any of you have done any kind of mindfulness or yoga or contemplative prayer, you're probably familiar with that kind of breath work. I think every culture all over the world throughout history has had ways of kind of tuning inward, right? And breath is one of the ways that we do that. So Herbert Benson was a doctor in the 70s and 80s, and he was studying the effect of stress on the body. A lot of this is pretty well known to us now, but he was one of the pioneers of this. And he was interested in lowering heart rates, lowering blood pressure, changes for heart disease, and even diabetes and stuff like that. So what he had his patients do was what we just did for about 2 minutes. And normally he would have folks work up to about 10 minutes a day. I think he had them do it twice a day. And what he expected was what he found, which is that if you only do this once or twice, then your heart rate will slow down and your blood pressure drops a little bit just for a few minutes. And then, of course, it goes right back up. But if people do this consistently, like what he had his patients do, then over time, they started to notice lasting changes. The blood pressure stayed a little lower. The heart rate stayed a little slower, all of that. And as I said, this is what he expected. What he didn't expect was what his patients told him, which was that when they did this consistently, a couple times a day, sometimes up to 10 minutes, whatever a day, they noticed that if they were in a stressful situation, like they were in traffic or in a stressful meeting or whatever, because they'd practiced it, and remember, our brain gets better at whatever we ask it to do a lot of, then they could take a breath or two, they could say their phrase to themselves, no one was aware of it, and their body would go, oh, I know what we're doing, okay. And it would start to slow things down. And when the body slows down, the brain slows down, and our thoughts tend to settle a little bit. And we become a little more grounded, a little more able to make decisions, or, Rachel mentioned, like, stops taking in information. We can start interacting, we can start regulating, really is the quickest way to say it. Now, it's not magical. You may still need to continue doing other stuff to calm yourself down, but this is a way to get us started. And I like teaching this to people, especially who are going to be doing direct service, because when you are in that frustrating conversation with a client, or when you are advocating for your client, or whatever it is, if this is an exercise that you liked and you want to continue it, the more frequently you do this, and again, maybe starting just for a minute or two, like we did, maybe building up to 10 minutes or more, then your brain and body will react the way that it has experienced it. Just, trauma is our brain and body reacting when it has experienced stress. This is our brain and body reacting when it has experienced something calming. And I like this because it's a skill you can kind of carry in your back pocket for regulating. And this may be what we need to do, just to take a breath or two before we start working on the calmer skills. And the calmer skills are a mindfulness-based protocol, some of which was based on the work of Daniel Siegel. So you may recognize some of the concepts there if mindfulness is something that you are interested in and you read about. I certainly kind of started there and acknowledged that work that he did. And this is a set of skills that we can take ourselves through. People always ask, can we teach this to our clients? Yeah, absolutely. This is great. But keep in mind, what we are working on is making ourselves available to help someone feel safe, connected, and in control. We're not working on changing or fixing them. So if the skills speak to you and this is something that you do with clients or you teach to clients, that's great. But this is about where we are, okay? So the first one we've already done a lot of over the past 2 days, and that is just check in. Here's that same question I've been asking you guys for 2 days. What are your sensations, feelings, and thoughts right now? And as I mentioned, the more you're used to asking that question, the more automatic that awareness becomes, the more kind of intuitive and available it is. The more you look, the more you see. So I really encourage you guys, in whatever framework works for you, whether it's this or something else, to continue asking that question. What's going on with me right now? And then the next thing, these really go together, is whatever the answer is, that answer is okay. And I think that a lot of us in the helping professions grapple with this, and this is not to exclude the dudes, but especially for women, We tend to be very critical of ourselves if we think that we're having a feeling or a reaction that we're not supposed to. We're supposed to be calm all the time. We're supposed to be available to everyone who needs us. And we sometimes are pretty judgmental if we feel strained or stressed or, ugh, I just don't want to take that phone call, or, ugh, you know what I mean? Or we lost our temper, whatever it is. So this is, I think, easy to say and hard to practice, and really requires a lifetime of work to genuinely, compassionately accept whatever we are experiencing inside of ourselves at any given moment, right? Now, accepting doesn't mean act on it, right? I want to push this client over. It doesn't mean that's what you should do, but it means it's okay to feel that, right? So check in, what are you experiencing, and accept that whatever that is okay. And then the next one, and you can see how these all kind of clump together. How can you think, say, or do something loving or kind for yourself right now? Now, if we're in the middle of something with somebody, we probably can't say, you know what, Tabitha, you are stressing me out. So I'm going to go take a yoga class, probably going to stop for a smoothie. I'll be back in 2 hours and we will finish this conversation. That would be great. We probably can't do that. So maybe in that moment, all I can do is take a breath or two and maybe say my little relaxation response phrase to myself in my head. Maybe I step outside and get a breath of fresh air. Maybe I drink a little water. A lot of times, a little fresh air and a little water do wonders for our bodies in terms of regulating. Another example is I have low blood sugar. I have to eat pretty frequently, or my blood sugar drops and I can get very cranky and irritable. Or as Kevin might tell you, more cranky and more irritable. I can get, kind of scattered and forgetful and all of that. And I know this about myself. So if I notice, if I've done the check-in, I'm feeling spacey and out of it because I didn't eat, I can be really mean to myself about that. What's wrong with me? I know I need to do this, blah, 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 blah. Or another choice I have is to just eat something, just get a snack. And that is why I am all about the snacks. So whether it's something I do or something that I just kind of think to myself, or even if I just say to myself, you know what, this is really challenging and I'm doing a good job. Maybe that's all it is. This can all happen within a second or two, but something that is loving and kind for myself rather than something that is mean and harsh and critical. Why? Because I need that dopamine and serotonin, man. And if I'm not with somebody at that moment who can provide that with me, maybe I can, during a shift, I can run to Tamika's office and have a chat with her and she's really validating and sweet and I feel better. But if I can't, I can do that for myself. Being mean and critical and angry at myself keeps the stress chemicals in my brain. It doesn't change the chemical situation. Saying something kind to myself or doing something nurturing for myself, even something small, does start to shift that. You guys see that? Okay. So check in, accept, and loving kindness. Where are we? CAL. Okay. Those are, as I said, pretty easy to do. You can do them in a matter of seconds. And they're internally focused. We're looking at what's going on inside of ourselves. Now we're going to turn it outward. Mindful. Now, mindful means a lot of different things now. It's kind of a buzzword, and it's so widely applied that I think we kind of stop hearing it. But in its simplest form, mindful just means noticing what's happening right now. And more importantly, sometimes what is not happening. So as I've mentioned, I worked with teenagers at a crisis center for a long time, and it was not unusual that we had to call the police, right? A parent showed up drunk and they were trying to take their kid, or there was a fight. And those of you who've worked with people, you know that it wasn't the boy fights. No, it was the girl fights. Because boys are like, it's a lot of posturing, right? Girls, when they fight, they're trying to kill each other. So there'd be some fight going on or whatever it was, and we would have to call the police. And we were lucky because our agency had been around long enough that we were pretty well known in the community. A lot of the local police force knew who we were. And so what I was able to observe was this huge split in how situations would go down. Okay. What I saw was that if a police officer came on the scene and she was relatively calm and not barking and shouting and yelling and kind of listening and taking things slow, things normally kind of calm down. And often they were able to resolve what was going on without having to take anybody away or whatever. And we were lucky in that that was often our interaction with the law enforcement, but that was not always the case. And sometimes and it was always kind of one or the other, it was usually not in the middle. But if someone came in hot and they were shouting and yelling and barking and, just like this, someone was going away in handcuffs. At least one person. I knew that the minute they hit the door. I got to the point where I could just read it. I knew how it was going to end up. And so when we see situations go out of control, especially with clients and staff, and for supervisors, this I think also is very relevant. Clients can do all kinds of crazy stuff, right? That's why they're in our program. So they absolutely can be volatile or doing stuff or whatever. But when a situation really spirals out of control, it means someone else escalated with them. A family member, a staff person, a police officer, whatever it was, someone went right up with them. And that's when everything really spectacularly falls apart. So if you were the person, trying to do the cleanup afterwards, or you're doing a report or, major unusual incident report or whatever, and you talk to that staff person or family member or police officer, whomever, and you're like, why did you do that? What they'll usually say is, well, I was afraid that ... was going to happen. In other words, they were reacting to what they were worried about or afraid of, not maybe what was actually going on. Okay, when your staff escalate with a client, they're worried about what's going to happen. When they're not worried about what's going to happen and they're just dealing with what is happening, they're more likely to be using appropriate interventions. Okay, so let's say that, I don't know. Let's say that LaShawn is a runner. When she gets stressed out, she takes off out the door running, which is a huge hassle and puts her in danger and other people and whatever. Now, let's say that Phoenicia and I are on a shift together. I know this isn't probably how it would go down, but so Phoenicia and I are working together, and we notice that LaShawn she's rocking and pacing and wringing her hands, and we're like, uh-oh, this is what she does right before she takes off. So Phoenicia comes over to me and says, hey, why don't you stand by the door just in case she tries to make a break for it? Is that an appropriate precaution to take? Sure. Yeah, absolutely. Should I run across the room and tackle LaShawn because she might run? No, that is not a precaution to take. Or, that's too much. That's an overreaction. Or like when a kid would be going off and throwing things around at one of our apartments or whatever, staff would say that they forcefully intervened because they were afraid of destruction of property. And I would always say, have you looked at our property? Who cares? I don't care if they throw a picture. I care that no one got hurt. So if you need to move people out of the way or whatever, great. Putting your hands on that kid, probably not a good idea, right? So mindful simply helps us not overreact. What is happening right now? And what is not happening right now? That's the question that people are asking themselves when they're using that calmer skill, okay? The next thing is expressing your thoughts and feelings about what's going on in this situation. Now, again, depending on what's going on, I might be able to do that right away. So I might be able to leave a situation and call Tanika or call whomever and go, oh my God, Tamika. So I might call Tamika and go, I just had this really hard thing and I had to take her to the emergency room and it was really stressful, blah, blah, blah. And I get to sort of do that venting and I get that support, but that may not always be possible. Or it might be something that I need to take my time with and I need to think about it. And maybe I go to my coworker or my boss or whomever and say, hey, I want support with this, or I think we need to do this differently or whatever. Okay. But my feelings have to have a place to go. Part of that other training that I talked about for the emotional self-care for helpers is that we sort of are sponges and we can kind of absorb the stress of the people that we work with and support, whether they're telling their trauma story or not. Sometimes, especially if they're not telling it, but they're just acting it out. We're just with them as they're having these dysregulated reactions. That's a lot of pain. That's a lot of stress. And that's a lot of fear for us to be exposed to. And our jobs are challenging. And if we don't have a place to regularly let that stuff out, it's easier for us to be overwhelmed and burned out And it's harder for us to get grounded and to help ourselves feel safe, connected, and in control so we can help someone else feel that. So whether that's right away or in the moment or later, we need to make sure we have those outlets. And this is where I think guys are actually at a little bit of a disadvantage. For women in our culture, it's often a little more common or a little more acceptable for us to need someone to talk to. And guys, I think, sometimes are more likely to feel like, I should just deal with it. No, if you guys want to be helpers for the long run, you have to find a way to take care of this. So whether this is friends or family or your significant other or your supervisors or clergy or therapist or whoever it is, even journaling, there has to be a place for this stuff to go. So it has to be able to go out. And then finally, as I mentioned, now we can respond. And responding is different than reacting. Reacting is what we may be doing in one of those emergency states, right? We might be hyper aroused or hypo aroused, and we're reacting to regain control or make ourselves feel safe. Responding means we've grounded ourselves. We've gone through that inner process of kindness and acceptance. We've looked outside at what's actually happening rather than letting our fear drive what we're afraid is going to happen. And now we can respond in a more appropriate, balanced way, right? It's going to be equal to what's actually happening. Obviously, this could all take place in a few seconds, or this might be a process over days and weeks. But these are the things I think that we need, not just to make ourselves available to the people we work for, to learn about them, to be present with them, to support them in helping them to feel safe, connected, and in control. But also, as I said, so that we get to keep doing the work that's important to us. So what I like about kind of doing things in this order is that the relaxation response or other, there are lots of breath strategies or other strategies. I just like that one because it's really quick. Doing maybe a second or two of breathing and doing this, the phrase inside your head, and then taking yourselves through these steps. I'm not saying that you will be, the Buddha when you're done. You might still be feeling agitated, but chances are you're more grounded in the present. You're more aware of what's happening around you and how you may want to respond appropriately to that and how you're going to take care of your own needs and feelings, whether it's in the moment or later. And I think this puts us in the best position to help our clients experience us as safe and grounded and self-aware and regulated. Remember yesterday when I talked about, for many people with trauma, not everyone, but probably most of the folks you're going to work with, they weren't traumatized by a tornado. They were traumatized by people. Often people in relationship with them, people perhaps who are supposed to be taking care of them or looking out for them, are the people who hurt them, who wounded them. And now we're asking them to somehow enter into that lion's den again, but this time we want them to experience healing instead of damage. That's a very hard thing for a human being to do. But I believe they can do it. I believe human beings can heal from trauma because I've seen it. I've watched people do it. And there are lots of different things out there that can support someone, right? We've talked about some of them. Trauma therapy and medication to help with the symptoms or the depression and anxiety. I've worked in places that had art therapy and music therapy and horse therapy, and all of those things are great. And I wish we had a country where all of that was available to everybody all the time, where the disparities in the medical and mental health system were corrected and everyone had equal access to all of it. I wish we had that, and I believe that maybe someday we will. But it's okay that we don't right now. And the reason that it's okay is that we understand how the brain actually works. We've been talking for 2 days now about how the brain responds to whatever it experiences in the world. And if that's toxic, then the brain reacts to that and actually changes to that. The brain also reacts to things that are safe and predictable and caring. And with enough of those experiences, we start to see the brain begin to change. So people begin very slowly to spend less time out of their window of tolerance, and they come back into their window more. And remember that slide, the more time you spend in your window of tolerance, the wider that window gets. And the more it takes to kick them out of range and the quicker they can come back. In other words, their brain starts to heal. Their brain and their body and their nervous system start to change. People have sometimes asked me, can we ever get people to the point where they are as they would have been if they'd never experienced any trauma at all? I don't know, is my answer to that. And again, as is true for many of the women you're going to be working with, when trauma happened early in life, we know that it's more damaging neurologically because the brain is still wiring itself, essentially. So if trauma has been early and severe and chronic, maybe not. They may always grapple to some extent with that level of traumatic stress, but I know they can heal, and I know that brains can get a lot better. And so I really want people to have all of those therapies and all of those resources. But what they really need the most is the experience of being in a relationship with a present and regulated and helpful person who cares about them, who's going to help them to feel safe and connected and in control. And that's you guys. Either because you are having those interactions directly with that woman, or you are supporting and supervising the staff who are going to have those relationships and those interactions with that woman. And this is sad to say, but sometimes you guys and your program may be the first time that they have ever consistently experienced that with people. You guys are it. And so if I had to choose between all of those therapies and all of those resources and all of that medication and you guys, I would choose you every time, because you are perfectly in the position to help women have those experiences over and over and over that will actually help them heal from trauma. At the beginning of our time together, I talked about that beautiful quote from Genet, that trauma is a disease of not being able to be here. And I said that the real tragedy of trauma is when people aren't able to live their lives as their true selves because they're not present. They're reliving past experiences, or because the state has become a trait and people look at them and treat them as if they are dangerous or apathetic or disconnected, or they believe that about themselves. And you help them to change that. You help them to become the people they actually are. And you help them to live their lives as opposed to missing it. And sometimes they're not going to be able to thank you for that. Sometimes they might, sometimes they don't. And so I would like to take this moment and thank you guys for them, or for the young children that you are helping to have a different beginning than their mother did because of what you're providing. So thank you guys for what you're doing and what you're going to be doing in these women's lives. And thank you for spending this time with us. We've had a really fun 2 days with you, and I'm really excited about what you guys are going to be doing. So we'll go ahead and wrap it up there. I want to open up the chat section, and also if you guys want to unmute for anything, love to hear what your thoughts are. Angel mentioned that after doing the relaxation response, she feels relaxed, reset, at one with my thoughts. Excellent, Angel, that's great to hear. Thank you, Bridget, for attending this training. It was super fun, and I'm really excited about what you guys are doing. Any other comments or questions, please feel free to share them. You can go ahead and unmute yourself if you want to say something, and I'll make sure these are more slides than I have time for, as always, but I'll leave you guys with this. LaShawn, thanks so much. Thank you. And thank you for being an example in one of my stories, even though you didn't volunteer. Any other comments or thoughts or questions that folks have? And I'll also take a moment here and let you know that, you know, once we have a relationship with you guys, we're always here to work with you. I know we've got something planned in the fall. If you have questions or comments, please reach out to us as well. I know Kevin put the content information up as well. So Rachel said, how hard is it to get trauma support for our Medicaid women? That's a really interesting question. It kind of depends on what Medicaid program they're in, and Kevin actually knows more about that. But my experience is that, like, for CareSource, I actually take CareSource in my practice, and the benefits are pretty decent. In terms of finding culturally competent support, that's another question. Again, you know, it's kind of like the conversation that Tamika and I were having. I feel like it's more of a conversation in the mental health world. I know a lot of therapists are working very hard to make sure they are offering culturally competent services. I know that, for example, racial trauma is a sort of a newer area in the trauma world, and there are a lot of trainings and stuff that are now being available that really, even 5 years ago, I wasn't seeing nearly as much of. So I think the best thing to start out with is talking to the therapist or talking to the mental health program that you're trying to get someone in and asking them these questions, and they should be able to answer you. And if they can't, that's not the right place. But I do think that Medicaid actually does okay, at least with some of the traditional office-based counseling stuff. Nice to know Take Care Source. Yes, I do. I should tell you guys, I'm not currently taking new clients, but I probably will be again in the next month or two. So let me know. I love, love, love working with women and traumas. So, and there's other stuff we can talk about as well in terms of like some group staffing, or if you guys want to talk more about specific cases once you're working with folks, I'm always ready to do that as well. Any other comments or questions? These are great. And again, as I said, if something occurs to you later or you just don't feel like typing it all out, please feel free to reach out to us. Well, thank you so much, you guys. It was super fun. I'm looking forward to having more conversations with you. And again, I'm really excited about what you're going to be doing. So have a great Tuesday, I guess it is. And we'll talk to you guys soon.